Hello, it's Don Goldman from the Institute for Healthcare Improvement. And I know that in the videos I've been making, we've been really focusing on COVID-19, which is absolutely appropriate given all the problems we have. I should mention that it's really heartening to see that immunization of long-term care facility residents really is increasing in the United States. And I hope that those of you who are viewing this video are in fact beginning to benefit from these vaccines and rolling them out to your residents and staff. So while we focus on COVID-19, I just want to share with you something else that's really been bothering me. Really a more silent and a little bit under the radar pandemic of antibiotic resistant bacteria. And I'm going to start by showing you a slide. If I can just share my screen here. It's actually a rather complicated looking slide, but if you'll bear with me for just a second, I'll explain why I'm showing this to you. This is a slide that demonstrates a really serious outbreak of a bacterium called Klebsiella pneumoniae at the NIH Clinical Center some years ago now. It's probably almost a decade. And this outbreak was caused by a very resistant microorganism that contained the genes for what is called the NDM1 beta lactamase, actually to be specific, the New Delhi metallo-beta lactamase. Well, why was that important at the time and why is it still important? This mechanism of resistance makes the carbapenem antibiotics, one of our last line antibiotics, basically ineffective. And it makes these infections incredibly difficult to treat. And this type of resistant to antibiotics has persisted and spread globally since that time, and has been joined by a number of other mutations that render a different set of microorganisms, including Klebsiella, resistant to our most powerful antibiotics. So in essence, we have a global pandemic of serious bacterial resistance to the antibiotics we rely on as our last line of defense. In this particular outbreak, there were 17 cases introduced by transfer of a patient from New York. And that New York patient had acquired the genes due to the global spread of this antibiotic resistant mechanism all the way from India, starting in New Delhi. You can imagine the people in New Delhi are not happy about the naming of the strain. We tend to name things after where they came from. So we've seen this with the China virus, and the people obviously resent the fact, but that's the epidemiology of where this resistance came from. What you see here on the slide is the tracking of that strain around the clinical center to 17 additional patients, 6 of whom died because of their infection with that Klebsiella pneumoniae. This was whole genome sequencing, the very technique we're using now to track the variants of COVID-19 that are spreading around the world and have now appeared in the United States, including variants from Brazil and South Africa that may be a little bit more resistant to the protective effect of our current COVID-19 vaccine. So I'll take this very complicated slide down now, but it was made possible, that epidemiology was made possible by the whole genome sequencing that's such a powerful tool in our arsenal of fighting COVID-19 infections. So while we're focusing on COVID-19, which as we know has droplet spread and airborne spread, we tended to pay less attention, although we still worry about it, to the spread of COVID-19 on the hands and by surfaces. Now, COVID-19 tends to be relatively fragile and does not survive for a long period of time on those surfaces. But the organisms that are causing antibiotic resistant infections in your long-term care facilities, some of them can survive for quite a long time. And you're familiar with some of these organisms, I'm sure. Methicillin resistant Staph aureus or MRSA, Acinetobacter survives quite well in the environment. Certainly Clostridium difficile, now called Clostridioides, they just changed the name, that causes antibiotic-associated colitis, survives really well in the environment. So for these infections, you have to pay incredible attention to hand hygiene and the role of contaminated surfaces, the technical term is fomites, in helping transmit these bacteria. So while we're fighting COVID, don't take your eye off the ball of these other infections, these bacterial infections that cause so much trouble and so much mortality in long-term care facilities. It turns out that long-term care is the nidus for the expansion of these organisms, for their spread within the facilities and then to the community and to the hospitals when patients, residents are transferred to other facilities. Much has happened with, we spread COVID beyond the walls of long-term care facilities to the community and to other facilities. So pay attention to these other threats and try and reinforce hand hygiene and decontamination of the environment due to antibiotic-resistant bacteria. Now, infection prevention is one piece of that puzzle. The other is antibiotic stewardship. And we know that the Centers for Medicare and Medicaid Services and the CDC have been giving guidance to long-term care facilities on how to use antibiotics more prudently. And obviously that's difficult because it's hard in residents of long-term care to distinguish between colonization that isn't causing symptoms or true infection and actual infection that could in fact take the life of the resident. So I encourage you to take a look at the CDC resources on antibiotic stewardship and to pay some attention to that while you're also trying to deal with COVID. I know this is a heavy lift, but I'd feel remiss if I didn't bring it up and remind you of these other dangers and the toll they take on the residents in your facility. You know, everybody really tries hard to pay attention to these issues, but I remember I did a study once in neonatal intensive care unit where these babies are 700,000 grams, and everybody, believe me, that staff was incredibly tuned into the dangers of these antibiotic resistant organisms. But when I cultured the hands of nurses and physicians in that unit, even as they were leaving the unit to go for lunch or whatever, the majority of them were harboring large numbers of antibiotic resistant organisms on their hands due, I guess, to the failure to practice really good hand hygiene after they touched contaminated surfaces or care for babies who happen to be colonized. So I'm well aware of how difficult this is, but please try and pay attention to these basic hand hygiene and environmental control factors that spread antibiotic resistant organisms, some of which we barely can treat even with our most advanced antibiotics. So thank you for listening. I just wanted to share that. It was a concern I was having, and perhaps catalyzed by an article recently in the New York Times with quotes from the CDC that some organisms are in fact spreading more rapidly now in long-term care, including a really worrisome Candida species called Candida auris, AURIS, that tends to cause serious infections. So be aware and thank you.